In our final standard in the skeletal system, we're going to be talking about what happens at the meeting place of two joints, and we tend to only think about the mobile joints like the elbow or the knee, but joints are really any place where two bones come together, most of which are not mobile. And so we'll highlight the three primary categories of joints. Your standard reads, I can explain how different types of joints function based on their structure. This covers section 8.1 of your textbook. Okay, so that's the same heading, but maybe a new page for BONE.7. Let's first define joints. So joints are sometimes called articulations, and it's a functional meeting place between two or more bones. A lot of times, three bones will come together in one place, especially if it's a mobile or more important joint. These joints are also capable of keeping your skeleton together and creating a very cohesive structure, and oftentimes allowing movement and even actions like childbirth. Okay, types of joints. The first two categories are immobile, and they're differentiated based on what is in between them. So first are fibrous joints. These are held together with dense connective tissue, usually dense regular connective tissue. These joints are really largely immobile. There might be some twisting or small movements that are available, but most of the time these joints are not going to have any sort of motion associated with them. First subcategory is called a syndesmosis, and a syndesmosis is a sheet of connective tissue in between two bones. It allows for some twisting motion, and it can be seen in the area between your tibia and your fibula, which would be the two long bones of your lower leg. So those bones, the larger tibia and the smaller fibula, are held together by a sheet of connective tissue, creating the syndesmotic joint. The second class of fibrous joints is a suture, and we've mentioned these before when we discussed the flat bones of the skull. So these bones are held together by a really thin layer of connective tissue. It's not a sheet, it's almost just like a little layer of glue. These joints are completely immovable. There shouldn't be any motion between the bones of your skull. And of course, the example would be perhaps between your parietal bones or between your frontal bone and your left parietal bone. Any place where you have those broad sutures. The last fibrous joint is called a gomphosis, and it's highly specialized in the area of the tooth. So bones here are held in by what's called a periodontal ligament. So it's a very special ligament that's meant to allow your teeth to have a little bit of motion so that they don't shatter or don't fall out as easily, but keeps them in for decades and decades. The example here would be any of your teeth and your mandible, or any of your top teeth and your maxilla. Those would highlight gomphosis joints. Our second broad category are cartilaginous joints, which obviously are held together by cartilage. These joints are also highly immobile, maybe again some twisting and contorting, just to allow for flexibility so we don't have shatters or breaks. There's only two kinds of cartilaginous joints. The first is a synchondrosis, and this uses hyaline cartilage to unite bones. The example we've discussed would be our costal cartilages that connect our sternum to each of our ribs. The other kind of cartilaginous joint is a symphysis. A symphysis doesn't use hyaline cartilage. Instead, it's a pad of fibrocartilage in between your bones. Also very limited movement, and the examples here would be the pads in between your vertebrae. So those intervertebral discs are made of fibrocartilage, and there's a little pad of fibrocartilage in between your two pubic bones. So that is also a symphysis joint. The last classification of joints is the most mobile. It's the one we associate with joint movement, and those are called synovial joints. Synovial joints are unique because they have a joint capsule that's filled with a yolk-like fluid that sort of lubricates the bones and makes sure that there is fluid continual motion. So we don't have joint capsules in fibrous or cartilaginous joints. This is only going to be in synovial. Different ranges of motions are available depending on how the bones come together and how the ligaments and tendons are organized. So we'll highlight the 6 specific types. But some general parts that all synovial joints have. they all have articular cartilage around those epiphyses. We drew this on our picture of a long bone in the last unit, but just remembering and highlighting that it's not just this joint cavity here with the fluid, there's also cartilage protecting your bones. We again have that synovial fluid, that yolk-like, very fatty substance. We have ligaments which connect bone to bone and keep that joint strong and keep those bones in alignment. And now we're going to classify the 6 major types of synovial joints. They differ based on the shape of the 2 bones that are coming together, as well as the motions they're capable of performing. So first is a ball and socket joint. A ball and socket joint has a round bone that's fitting into a cup-shaped cavity. This has your widest range of motion. You can do flexions and extensions, abductions and adductions, rotations. This is a highly mobile joint. And for that reason, our most important joints are ball and socket. So where our legs meet our axial body, where our arms meet our axial body, these are ball and socket joints. Condylar joints are sort of like ball and sockets, but they're much more limited in motion because they have an ovular head or a condyle that fits into an elliptical cavity. So instead of being a nice spherical joint, this one is an oval. For that reason, these bones can move back and forth, but they really can't rotate. They don't have quite the motion of the ball and socket joints. You can find condylar joints in between your metacarpals and your phalanges, so that would be at your knuckles, where your hand bones meet your finger bones. And your fingers do have a relatively wide range of motion, so that does make sense, but you can't rotate your fingers like you can rotate your legs. Third type is called a plane joint. This is when 2 almost flat surfaces come together and they have extremely limited motions. They're pretty much just going to be gliding past one another to keep the bones from crunching up and to allow mobility of a greater joint that's next door. So the example here would be all those small bones in your wrist and your ankles. These are going to have this plane joint effect where they can slide past each other a little bit, but you're not really doing too many motions. The wrist bone that we really think of, or the wrist joint rather, is in between the radius and ulna and these carpals. But this is saying in between 2 carpals. A hinge joint would be like your elbow or your knee, where we have what's described as a convex surface meeting a concave surface. And for this reason, there's a really limited range of motion. You can pretty much flex and extend these joints, and only in one direction. So your elbow can only bend anteriorly, and your knee can only bend posteriorly. Extremely limited range of motion, but that's the design of the joint. A pivot joint obviously allows you to turn side to side. Here we have like a pin with a cylinder pin with a tube around it. So it kind of is rotating around that central pin. This joint is primarily for rotations, and we see it in between the atlas and axis of your cervical vertebrae. So your head sits on top of this vertebrae, and it's allowed to spin because the bone underneath it, the axis, has a little spike that the atlas swivels around. Last type of synovial joint would be a saddle joint, and this is when 2 saddle-like shapes come together. They're both convex and concave, and they're really uncommon. We're only going to see them in between the carpal and metacarpal of your thumb, which just gives you a slightly broader range of motion than your fingers have, unique to our opposable thumbs as members of the ape family. So those are the various types of joints. You will be acting out specific synovial joint movements as part of your final standard for this unit, but this is some good information to refer back to when highlighting joints.